Good evening once again. It's a pleasure to be back, and it's a pleasure to discuss one of the critical issues that we need to focus on as a society and as the medical fraternity generally. So, yesterday on 17th of September, we marked World Patient Safety Day 2022 under the theme Medication Safety with the slogan Medication Without Harm. And this is a very important topic, especially understanding that at any one point in our lives, every individual will or have used medications. And therefore, if we've all used medicines, the question we need to be asking ourselves what is the potential harm that these medicines can cause us? And if then we understand the potential harm that lies in the use of medicines, then we need to ask ourselves, how do we protect ourselves from getting the harm? And how do we, as the healthcare fraternity, the pharmacists, medical doctors, physicians, clinicians, everybody is involved in the healthcare system, play a role to ensure we reduce this harm as much as possible? Because at the end of the day, when you're using your medication, the hope is to ensure that you get well if you're unwell, and also to improve your health condition so that you're in a good state. It's not for the medicine to actually make you sicker than you were at the start of the moment. And also, one of the key things that we all acknowledge is that not all medicines are safe. And even the medicines that we hope are safe, it's because the benefits outweigh the risks. And that is why when you buy your medicines and you see the leaflet insert, it normally has some indications and also the side effects that are expected out of that use of medicines. You'll find somebody taking a particular medicine and it's indicated after using that medicine, you should not operate heavy machinery because there's a risk that you might get drowsy, sleepy, and that is a side effect of that medicine. Those are understandable and those are things that are manageable. They don't cause as much harm. But what if you were told that a medication that you're using would actually cause death to you, would actually make you suffer from cancer, contract some cancer? One case example that we can talk about is the thalidomide case that happened a while back. That was the initial phase. This medicine actually resulted in patients having very severe conditions, especially among the children that were being born, phocomelia, limbs that are not there and all that, because of the side effects of that medication. So when you ask yourself, what are the dynamics of World Patient Safety Day? Why do we celebrate this day? This is a day that is dedicated by the WHO, World Health Organization, to ensure that we drive agenda, we create awareness, and make a commitment to promote patient safety. Because if we are serving our patients, if we are serving patients ourselves, we need to be well. And therefore, this is a day that we all commit to look at and actually reflect on what are the advances that have been made, what are the gaps that do exist, and how can we as a society work towards a better future where we can all ensure that our patients are safe and the medication in this case they're using are not causing them harm. So for this particular question, then we need to ask ourselves, what is the current situation in terms of our medicine use and the impact of medicines in our livelihoods? We know one thing that exists is the irrational use of medicines, whether they are prescription or medicines or the non-prescription medicine that you buy over the counter. And when we talk about irrational use, this is where we're talking about you using medicines for the condition that they're not indicated for. You get unwell, you go to the pharmacy and you're like, well, I've been having a cold, I need amoxil. Yes, you might call for amoxil and it might be dispensed to you, but the question is it really what you needed at that particular moment? Is there a diagnosis for that particular condition that would necessitate the use for that medication? If that doesn't happen, then that is rational use of the medicines. And those are some of the challenges that we're dealing with. It can be prescription or non-prescription medicines, regardless of which classification. If you're using it for what it was not intended to be used for, that would be wrong. The other thing that happens is you've been told to take a particular dose. Let's say, for example, it's paracetamol. You're told to take 2 tablets thrice a day or when necessary. And then for you, you start taking them actually after every 1 hour. It means at the end of the day, you'll have taken more than what is expected of you, overdose. Or you are told to take your medication and antibiotic twice a day for 5 days, but that is the complete dose. And instead of taking the medication as prescribed, you start taking them day 1, day 2, you feel better, you stop using them. That is rational use of medicines. And those are the realities of our lives, what we are dealing with every single day. And when these things are happening, we need to ask ourselves, what are the implications? How can it affect us? And definitely it does affect us. When we're talking about antimicrobial resistance now, either you're using an antibiotic when it's not necessary, or you are using it half of the dose, not full dose as is required of you. And therefore you are causing more harm in the sense that in case you fall ill again, you become sick, you will not be able to get the help, this treatment. The treatment will not serve you. You'll not get cured by the medicine, or it actually would need a longer period of time for you to get treated. And those are risks that we're taking by ourselves. Then we have irregular and illegal trade in medicines in the country. This is a bit when we look at it from the regulatory standpoint, where the Pharmacy and Poison Board play their role. And in that case, then you find that there are medicines that are not registered by the regulatory authority, but they are circulating in our market. You find that medicines are actually illegally being traded in the country because somebody trading them is not a qualified pharmacist or pharmaceutical technologist, is not operating in a licensed premise. They're manufactured in a site that is not meeting the standards. And that is where we now have the aspects of falsified, fake medicines, counterfeits, and substandard end products. All these are coming into our market. And one of the key things that I also look at it from that is the parallel importation of medication, which people would say, well, it comes, maybe some of the cases it's cheaper than what we have in the local market that is registered. Definitely it might be cheaper, but you ask yourself, if this medicine was made to be environmental conditions which are below 25 degrees centigrade or even less than 20, and now you're bringing it to our environment where the standard temperature recommendation is below 30. It means if it had 3 years of shelf life, in the third year, if it's in a different climatic condition, it might not be useful anymore. All the active ingredient is exhausted. So what measures are in such kind of conditions? And those are things that we need to look into and actually ask ourselves, are we causing more harm to our patients or not? Because when we're doing that trade in the parallel importation aspect, we need to ask ourselves, what value are we offering the patient and to what end? You might argue for the cost, which is cheap, yes, somebody will say it's cheap, but the question is, would you rather buy cheap poison or buy expensive quality product that will ensure you are safe and you're getting value for your money in terms of your treatment? Those are things that we need to look into and that we need to look at in the long term. Then we look at it from the abuse of medicines. We know that people are using medicinal products for non-medicinal purposes. One of the case that we can look at it in terms of one, there's the actually increased use of codeine and codeine-related products where people are using them as drugs of abuse to get high, which is not recommended. And that is where, as pharmacists and pharmaceutical technologists, in the areas where we practice, we need to put controls and ensure patients are not getting medicines they don't need because they just go to use them. Unless there's a clinical condition as to why they need them, we need to look at that. Then we know the basmati babes, everything, conversations around drugs being used to less alcoholic drinks and actually as to aid in crime and all that. We need to ensure this is not happening. And the only way to ensure it's not happening is by regulating the access points and the means of access so that it's not getting to anybody and everybody who needs it. So when we look at all these kind of aspects, what are the touch points for us in terms of promoting medication safety and ensuring there's medication without harm? Regulatory system strengthening. That is where we need to work with the regulatory authorities, Pharmacy and Poisons Board in this case in Kenya, to ensure that they're able to regulate medicines getting into the country, the sites that are producing them, the people who are trading in them, and ensure that any medicine coming into the country meets the required standards in terms of where they need to be traded in, who needs to trade in them, the language provisions, and the storage conditions are all optimally designed and actually attained. If that is not done, we are going to fail our patients because we are not sure who will sell it to them. We are not sure where they'll use it, how they'll use it, and what are their probable reactions to that medication. So that is where we need to ensure we have a regulated system, and even the police enforcement agencies need to engage with the regulator to ensure, in case anybody is apprehended for having dealt in falsified, fake, or even in irrational trading in businesses, irregular traders, then we need to be able to hold them accountable and actually arraign them in courts. Then the other bit is in terms of transitions of care, which I actually did a video on earlier. And when you talk about it from transitions of care, then the most critical thing that we need to ask ourselves is, how are we ensuring that our patients are not being affected at the transition of care? When, let's say, for example, you're coming from level 2 to level 3, level 4 to level 5 or level 6 hospitals. At that transition of care, they're using this medicine A at this lower level, they're moving to a higher level with a different medication or so. And if this is happening, then the question is, who is going to ensure they follow through to ensure the medicines are still being given the way they needed to be given and that at the right time they need to be given? Or somebody leaving the hospital and coming home. At that transition of care, who guarantees that the patient has the medication they needed? And if that is not guaranteed, that is a loss for us. Who ensures that actually when the patient goes home, if they have the medicines, they will follow up in their dosing as recommended for them? If that is not done, then we are losing out on that. And that is where actually as a community, we have a role to support the person who has the duty of care, Who is the caregiver to the patient? Who is the physician or the pharmacist? How do we ensure that we integrated and actually supporting the patients in their care journey? That is an important bit. And if we miss out on that transition of care where they're coming from the community to inpatient, or they're leaving the hospital to back to the communities, or even to care homes and all, we need to know at that transition, are they in the right medications, in the right dosing, and will that continue being used the right way it needs to be used? If that is not done, we'll be losing our patients and we'll be harming them more than we needed to. Then the other bit is at the pharmacy level. Oftentimes, most of these medicines are being bought from the pharmacies or dispensed at the pharmacies, whichever way. But when they're being dispensed at the pharmacy, then it means as a pharmacist or a pharmaceutical technologist who is running the pharmacy, you have responsibility to actually ascertain that the medicine is the right one for the patient. The look-alikes, sound alike are issues that we have to look at. You find the same different medicine, yes, they kind of sound the same, and therefore for a pharmacist, you might actually give the wrong one. You need to be keen on such. The dosing that you're giving, it's maybe 5 milligrams, you're giving 50, or you're giving even 500 milligrams because you didn't see the kind of the writing, the prescription writing, handwriting of the doctor, physician. You need to counter check and actually verify. And then we have to be responsible, especially for antibiotics. At the pharmacy, are you guys going to dispense antibiotics because a patient asks for them? Or are you going to dispense because there's a clinical need that has been established? If that doesn't happen, we are failing. And then the other medicine that we're talking about, the medicines of abuse, we need to put in controls. From a patient perspective, when you come to the pharmacy, you need to ask yourself, what medicine do you need? And if you need it, then why do you need it? Can you share that information with the pharmacist or the pharmaceutical technologist so that they can actually make an informed decision whether it's the right medicine for you or not? That will help you ensure you get the right medicine. Once you've been given your medicines and you know why you've been given that medicine, you need to ask yourself, how do I use that medicine? And that is where you need to ask more questions to know better. Because if you don't know, you will not be able to actually follow up on that treatment. And if you don't, then it might cause you more harm than good because you just fail to ask a question. So then the other thing you need to look at is asking those questions, check on the validity. When is that medicine expiring? At times you get to a pharmacy, you buy your medicine, and you find it's a very short expiry, or actually it's expired, but because you just buy and walk away, you're getting an expired medicine which might not have value for you, might even be poisonous to you because you didn't get keen. So know, check, and actually ask questions where need to be asked. And the clinical wards, that is where we look at it from a pharmacy standpoint, medication therapy monitoring. We have physicians, we have the clinical teams. When we're working in these wards, do we collaborate from the laboratory personnel, from the physicians and the clinicians and the pharmacists, so that whenever we are recommending the use of a medicine, we've assessed the patient, we know why they need them, what do they need them for, how are they going to take them, are we going to follow up on their treatment to ensure that patient gets maximum value out of this medicine. And most importantly, as we come to the end of this, is World Patient Safety Day. And one of the greatest ways that we can promote patient safety is actually by engaging patients and engaging the general public to hold ourselves accountable, to hold ourselves, to take responsibility for medication safety. And that is through public forums, community engagement caucus, and then education of the public so that we all know we have a role to promote our safety as patients and promote the safety of the people we are under care of, especially around medicine use. Because if we don't do it, we are losing out and we are harming our own very people who count on us and depend on us to help them deliver the best care that they need, to help them live healthy lives. So what are we going to do about it? Let's make a commitment to promote knowledge sharing. That is the most important thing. Beyond knowledge sharing, we need to ask questions, know what medicines we are taking, check whether we are taking in the right way. And if not, then we need to be able to report. The regulatory authorities, we need to hold them accountable, but also support them in coming up with regulations, policies that will ensure we promote patient safety where and when it needs to be done. Otherwise, we'll have cases that will be affecting us as a society. It will be affecting us as individuals. And that is not what we wish for. Medicines are supposed to help us get better, to help us stay healthy. But if they are going to cause more harm to us, then that would not be an intended outcome. And we want to try as much as possible to avoid such probable outcomes that we don't intend to have. So thank you so much for engaging. If you enjoyed these kind of discussions, please subscribe, share, and comment as much as possible. Give me ideas on what you feel we need to discuss again, and hopefully we'll make the best of it as we become more enlightened as individuals and as generations. Thank you so much. Subscribe, like, and share.